Hey, everybody, and welcome to the Athletic Potential Podcast, episode 23. And as a general review of each podcast, we go over a case to start. It's typically the last patient I treated prior to the recording of this podcast. And then we go over questions from our audience and then finish with a general recap and summary. And so let's jump right into our case today. Just more recently saw a 21-year-old baseball player, collegiate baseball player, and he's had a long standing of shoulder pain, and I am probably the third or fourth clinician that has seen him and worked with him. And so two things come along with that. One, he comes with a lot of experience, having done fairly good rehab before, having all the shoulder exercises and other scapular work and those type of things, as well as some postural training. And he's gone through it all. And the problem is, every time he attempts to go back to pitching at a higher intensity, his pain returns. And so he came in and saw me, and knowing that he's been seen by multiple clinicians and other practitioners and had plenty of rehab, and a little concerned with the fact that he's had all of that and he continues to have pain. We were lucky enough that he actually had an MRI, and the MRI indicated nothing wrong in his shoulder. And so I went ahead and evaluated him, and what we found almost immediately is that he had a significant difficulty maintaining the center of basically the ball in the socket of the shoulder joint. And I tested him for instability and what we'd consider like labrum problems or capsule, the soft tissue that holds the shoulder together. I tested for all of it, and I expected to find some significant laxity, just looseness of his joint, and I didn't find it at all. And matter of fact, in a couple of positions, he demonstrated he was a little more stiff, like he couldn't glide. The ball wouldn't move forward very well, and he was having some problems, and all of his pain was in the backside of his shoulder. And so from there, we decided to do a little bit more testing in regards to strength and in coordination and activation and those type of things. And all of his strength testing came back fairly good, except for one test. External rotation was weak compared to his non-throwing side, which is a concern. We definitely want to address that. But everything else actually came back fairly clean and looked pretty good. And so we kind of scratched our heads a little bit, thinking, okay, maybe it's a postural thing. We tested posture, we tested movement screens, and all of that tested pretty good. And so we were lucky enough that he had a video of him pitching. And so we pulled the video of him pitching. We were able to watch it, and we saw a few things. But to be honest, again, nothing out of the ordinary. Nothing that we were like, oh yeah, this is what we're dealing with. And so after reviewing the video, we went back and did a few more tests on the shoulder, trying to just find the area where he has actually most of his pain. His pain was mostly in external rotation with layback, and it usually leads us towards a diagnosis of internal impingement. It's basically where the one of the tendons of the rotator cuff gets pinched between the ball and the socket. And we tested everything back there, and none of it was really that irritable. He had mild pain with external rotation, layback, us passively doing it, and it was in the right location, but it was a pretty underwhelming test. And so we kept looking at different things, and that brought us to, and we'd already checked posture, we'd already looked at his shoulder blade position, and what I had him do is we had him stand in front of us, and we looked at just standing posture and where his shoulder blades were sitting. And they were traditionally sitting with baseball players we normally see, a little bit more depressed on the right side or on the throwing side, a little bit downwardly rotated. It's just basically just kind of looked off. And that's actually fairly normal. And then what I asked him to do is I said, hey, I want you to take your arms, go up over your head and back down. That looked fairly normal. We did a couple more movements, all of which looked fairly normal. And it wasn't until I asked him to go up 90 degrees of external rotation, and essentially trying to go from max external rotation to max internal rotation, that we saw some discrepancies. Basically, what we found is when he went to max external rotation, his scapula did not tilt. It just stayed put. It should tilt a little bit, and in his case, it didn't move at all. As a matter of fact, he went to go to externally rotate, and what we first saw was his rib flare, a little bit of lumbar extension. It was pretty minor. He's got a fair amount of layback, and it was fairly minor, but we noticed that that the scapular position was probably the thing that we're seeing the most. And so what we did is we put him up in 90-90. I went all the way back in the layback. I had him, try and hold it back there, and he immediately felt his pain. And I said, okay, now we're going to redo this test. And I basically took my hands, put them on his shoulder blade, and I tilted this shoulder blade backwards, and I had him do the exact same test. It was within seconds of the previous test, and his pain was gone. And we realized that not only did he have he had issues with that ability to maintain proper position of his shoulder blade, specifically in the throwing motion. And so we kind of said, okay, look, the tissue that's irritable and is getting mad is still that rotator cuff tendon. However, what we have noticed is that it's because of his shoulder blade. Well, so we kind of worked on the shoulder blade for a little while, and we got that a little bit better. And what happened is the minute he started throwing again, his pain returned. And we watched video, and he was getting in better scapular position. So we kind of scratched our heads again and said, well, why? He's still getting it. Like, are we dealing with a damaged tissue or something just bad in there? Maybe it's the MRI wasn't exactly new, so maybe it's more developing, but he was having the same type of pain when he had the MRI. And so we came to the conclusion that, all right, we need to test this a little bit more intricately in regards to the shoulder itself. We knew that the scapula wasn't optimal, and we fixed that, and his pain went away in testing, but not with throwing. And so what we did is we went back, put him up in the 90-90 position, put his shoulder blade in the right position, and we tested for mobility again in the shoulder. Basically, just took the ball, and I tried to wiggle it back and forth, up and down, side to side, rotate it, all of these type of things. And what we found is he was selectively stiff in one direction, front. He wouldn't move front, and he had significant laxity back. Now, we found that in the initial exam, but it didn't produce any pain. So what we did is put him 90-90, and I retested it again and pulled him into posterior to see if it happened again, and it reproduced his pain almost immediately. So what we found was that not only, I think he had the issue with the shoulder blade, but he had significant laxity or mobility of his build. The ball would just essentially go to the back of the socket and just go towards even further and pinch that rotator cuff tendon. So he still had internal impingement, but he had instability in the backside of his shoulder. And so what we did is we looked at maybe trying to improve his posterior cuff to hold the ball in the middle of the socket, and then really work on stabilization work, basically just to keep the ball in the middle of the socket. And I can tell you right now, this is basically where we're at. He's in a return to throw program. It's a fairly aggressive return. There's some reasons for that in regards to his college, and so we're trying to essentially see if he can earn himself a spot for the fall, or for the spring, or earn himself a starting job for the spring. And so he needs to pitch in the fall. And so we were able to get most of it at this point. He's throwing, I believe it's 120 to 150 feet. He has no pain currently, but he can tell me this. He came to me just the other day. Just the other day, and he looked at me and said, "Look, I can allow this thing to hurt. I can throw, and I know I can do something, and it'll make it hurt. And I also can throw and not do that, or do something else, and it will not hurt." And to me, that just tells me that his shoulder's unstable, and that he has to really have good mechanics of his shoulder blade as well as his shoulder in order for him to be able to throw at these higher levels. And we're hoping that his mound protocol goes well. That's coming up here pretty quick, but he is throwing quite hard right now at distance, and he has almost no pain. When I say almost, he has soreness, and that's about the only thing he's experiencing right now. So I think officially classified it as multi-directional instability. That was one of the things that came from the physicians. We looked at that. I don't know if it's a true multi-directional instability case. I think it's more along the lines of he has selective mobility backwards into the shoulder, and then you couple that with the fact that the shoulder blade just wasn't in the right position, and he was creating significant amount of stress and pinching on that rotator cuff tendon. So we're hoping that'll take care of it. He currently has normal strength tests all around. We also did a neuromuscular test on the posterior cuff with him, and he tested a little bit poor for that, probably about like a 5% deficit. To be honest, I have no idea if that's clinically significant or not, just based on our machine that we're using. However, what I found was I would really expect that posterior cuff on the right side to be doing a better job, to have a better activation potential. And that's something that we worked heavily on as well. So a lot of his treatment was, we talked about stabilization. I mean, we had everything in, we basically really needed to use a lot of feedback, whether it was hands-on feedback from us, biofeedback through the EMG, or some type of force feedback to allow him to understand what position he was in. And we had to retrain his shoulder to find the right position in the throwing position. The other thing that we noticed, and we just recently picked up on this a little bit now that we've been watching a little bit more video with him, is he does not do a very good job of maintaining shoulder position into protraction and retraction. And so, again, I don't know if it's a significant case of multidirectional stability of the shoulder. It's almost like a scapular problem, a shoulder blade problem. It won't stabilize, and then the shoulder gets loose because of that as well, and then he gets the pain he's experiencing. And so these are, it was kind of an interesting case, a little nervous for the player just because he had seen so many guys. We happen to just be around at this point, and so he was in town, and we were able to end up seeing him. And so hopefully this will allow him. This is the furthest he's thrown and the hardest he's thrown in the past 2 years, and he doesn't have any pain. So we're hopefully on the right track with this one. So something to take away from this case for general throwers is you can be too stiff, too tight in the shoulder, and that'll cause problems. And you can absolutely be too loose in the shoulder. And they are completely 100% different treatments. Unstable shoulders, we don't mobilize, we don't try and stretch out for obvious reasons. The fact that it's just unstable, it moves around too much already. It takes a significant amount of effort, not just strengthening, but retraining of the movement for those players, those overhead throwers to be able to respond well and to do well. And so you got to make sure you know essentially what the issue is in the shoulder, and not just throw strength at it, even though strength does work. But the problem is long term, and the higher level you get, it doesn't necessarily work that well. So anyways, it's a good case. So all right, so we're going to jump right into the questions now, and let's see, pull up these questions. So our first question comes from Emily. Emily says, I have a daughter who is a pitcher in softball. What is the most common injury for softball pitchers, and how can we avoid it? A couple things, Emily. Softball pitchers vary in injury rates, and this is pretty weak research, to be honest, depending on how old they are. And so I don't know how old your daughter is, and so we'll kind of answer a little bit more on a broad spectrum in regards to softball. And I'll mainly reference one or two studies that looked at injury rates and kind of lumped them into, like, okay, was it shoulder, was it elbow, was it foot and ankle, was it thigh, those kind of things. So I definitely want to try and give you a good answer to this, and then give you some pointers of really what we try and do with our softball athletes to maintain their health, and when we train them and do performance training with them. So Emily, first of all, if it's a youth athlete, essentially what we see in youth athletes, and not so much, we see it in baseball players, you always hear that little leaguer syndrome and those type of things. We don't see that too much in softballers, only because they don't throw at the volume of the baseball players do typically. Now, the windmill pitch is a completely different scenario, and it doesn't necessarily equate to a lot of little leaguer syndrome, because the stresses on the arm don't typically go through the elbow and don't go through the growth plate in the shoulder. I shouldn't say that. They definitely go through the growth plate in both areas. However, it seems like the stress doesn't ever exceed the bone, and so we don't see it quite as much there. But to get back more towards your question, in youth athletes, what we see is this general soreness, irritability of the shoulder, and then they maybe get some shoulder blade pain along with it. Most of these kids in the youth athlete realm, they self-limit, and it's really hard to throw. I mean, you think about baseball players, it's the same thing. It's really hard to throw if there's pain, right? That softball windmill pitch is a tough delivery. It's a tough pitch to learn. It's a tough technique. And I can just tell you in my experience, and I'll be honest, I'll get to the research in a minute, because there's no research on youth in regards to softball injuries that I've found. But just anecdotal, what I've seen is that these athletes typically self-limit. So if they have pain, they'll just stop throwing, they'll stop doing the windmill pitch, or you'll just notice they just can't really throw it very well. and typically that usually just means they don't pitch, at least until the pain goes away and they get a little bit better. So, Emily, if your daughter is a youth at this point, I basically work on tons and tons of technique. Get them with a coach if they want to be a softball pitcher. That is a significantly unique motion, and I think it takes a good coach to really train it and then teach it. And you can learn a ton on YouTube. I know that happens a lot, and people look at it and they try to mimic, and that's a great way to start. I can tell you this. And I don't know if I can really say this with a ton of confidence, but the idea is that I don't see a ton of softball pitchers of the youth variety that have seen a coach or a good coach that knows how to teach the pitch. I think it's because they learn the mechanics and they have a little bit less stress. But I think finding a coach is a really, really important thing. I have an 11-year-old daughter who likes softball, and she's been pitching a little bit, and that was my philosophy. I went right to it. I said, look, I can't teach this. My wife could probably teach this, but we kind of decided, and my wife probably should speak for herself on this one. I don't know if she just was like, I'm going to try and teach her, or if it's just have somebody else teach her. But my wife's pretty good at pitching. She's got a great sophomore windmill motion. And we decided to go with a coach, and so, but that's kind of the way we went about it. And I think that's probably the best way to avoid injuries in pitchers in the youth is to try to teach them really good technique. And sometimes it takes a really good coach to do that. So let's go ahead and look at like injury rates in regards to teenagers. So high schoolers is where most of the research is done, and a little bit collegiately. If you look at softball pitchers, the predominant injury or area injured is 100% the shoulder. So it's shoulder, and if I believe so, it goes shoulder, lower back, elbow, ankle, and at this point we're talking like really low incidence rates. But shoulder is by and far the most common injury we see in softball pitchers. Now that being said, what do we do about it? That was your question, and I can tell you this right now that most of these girls that we're seeing with injuries in shoulders for softballers, their strength levels are not where they need to be. I just think they come in at a level that is just not strong enough. And so we've really got to get them strong. Now, we do see some that just have tremendous amount of stress in their shoulder because they pitch a lot. But realistically, I can tell you this. When we get these athletes stronger in the shoulder blade and the shoulder, we see less injuries. When we do shoulder blade, shoulder, and core strengthening, we see even less issues in the shoulder. And then when we see general movement training, like generally the legs, mainly think like hamstrings, glutes, get those really strong and functioning in proper order, we see a ton less injuries, right? So we always talk about this kinetic movement-based approach. And that is really how we limit injuries. So Emily, if your daughter has not been trained or been taught to move or doesn't seem to move very well, I think the number one thing that would help her prevent injury is get it with a good trainer, somebody who can teach her the movements, hinge squat, push pull, those type of things. Make sure that she can do those really well. Make sure she has good posture. She knows how to maintain, proper posturing, lower back, pelvis, those type of things. And then not only that, but then also has good shoulder strength, good shoulder blade strength, and can move effectively. I know that sounds like a lot, but I'll be honest, good trainers, they know exactly what I'm talking about, and they'll do a good job at making sure that that's the case. Yes, you probably can do a ton of shoulder exercises. You can Google those things. You can find them on YouTube. I'm sure that there's a lot of good stuff out there that you can just have your daughter do that will probably help her, and strength will likely decrease the chance of her becoming injured. The only problem I have with that is the higher amount of stress she gets into, the more likely she's going to need the rest of those things. So, my recommendation is always, hey, if we have an athlete that's asking the same question to us, we usually have them come in, we do a consultation, we talk to them about it, and we get a general sense of how serious the athlete is in regards to training. If they're not that serious and they just they're playing rec league ball, which is just fine, or maybe a little bit of competitive, but they really enjoy being with their friends and that's kind of what they want to do, that may be one of those like, okay, we're going to start with strengthening and see how this goes. Those that are a little bit more serious and seem to be more into it, we don't hesitate to basically say, look, now's the time, let's get going. Especially if they're teenagers, like into high school. They really need the training at that point because they're starting to get into higher level stresses, their bodies are developing. That's a great time to get them training and get them stronger and get them moving better. And so, Emily, I hope this answers your question. Shoulders, 100%, followed by lower back in the research. That's what's been found. And I can tell you right now, good core strength, the more I think about it, I'm like, yeah, shoulder strength is important. But realistically, if I can get someone to have good core strength, that automatically offloads the shoulder a lot. And so you may even have to do shoulder exercises and do core strength, and you'll see improvements or potentially decreases in injury risk. But why not do them all, right? Why not just do core work as well as shoulder exercises and get the shoulder really strong and get the core working really well? And that'll decrease a lot of those things, and a lot of the risk in regards to shoulder and lower back injuries. So good question, Emily. I hope I answered it. Our next question comes from James, a little longer question. So here we go. I have a son who plays multiple sports. Good job. I don't know how, well, maybe we'll get to how old he is, but as of right now, we don't know how old he is. I encourage everyone to play multiple sports for as long as possible. And we'll get into that in a minute. And he is currently playing football, and his baseball coach is telling us that he needs to be practicing with his baseball team. However, the practices for his baseball team are at the same time as his football team. How important is it that my son continue to play and practice baseball so that he doesn't lose his edge in that sport? James, I don't know the age of your son. That makes this difficult to answer. So we'll just go general. Okay. So I'll answer this very generally. So there's a lot of subtle nuance on this. So there's some things that people probably disagree if taken out of context. So let me just say it this way. If your son is 12 or under, I would just say, look, go let him play football. Don't worry about baseball. Okay? And I know there's commitments there. I know that's you sign up for a competitive league team and they practice year round, and then you worry about playing time because they're not practicing with the team. Will they fall behind? I get that. But if you think about, I don't know, maybe I'm wrong and maybe I just have a unique population size that I look at. But realistically, I look at these 12U teams and the best athletes are playing. They're playing. The best athletes are playing. And I think at this point, you're still prioritizing athletic development over baseball development. And because I only think that making your son a better athlete is only going to make him a better baseball player down the road. And so my recommendation, if he's 12 or under, let him go play football. Now, that being said, I'll give you a specific example. We just had this exact same scenario come into Athletic Potential. And we talked to the father about this, and I said, look, at this point, I think your son needs to go play football. And let him go play football, have him some fun. That'll be the priority. And what I told him to do was, look, I don't think it's a bad thing for him to continue to throw. I just don't want him to do competitive throwing. I don't want him out there trying to pitch against guys. So if you find time, you can make it to a practice or two, go for it. Go to the practices. Does he need to be throwing bullpens right now? Probably not. Does he need to just be practicing grounders and other skills-based training like, hitting and those type of things, which, let's be honest, you don't hit for a while, you feel like you're behind. And I don't necessarily want him to feel behind, but the ideal would be go out and hit, take those hacks when you can get them, go out and throw when you can. This player happened to be a quarterback, so he was throwing plenty, so I kind of said that I don't know if you need to worry about the throwing part. Take some grounders, go hit when you get some opportunities, and let football be in season and go play football. So that was my recommendation to him, and I think it would be the same recommendation to you, James, if you're looking at like 12U. Now, if we're saying like 15U or 14U, not in high school yet, I'll be honest, it's very similar advice here. The main difference here is you've got to, how do you put this? I still want him playing football. Like, I'd go play football. That's your primary responsibility. I would not miss football practice for baseball practice. I would go to football practice. What I would then tell the coach of the baseball team is this: look, we'll do everything we can to keep his skills up by practicing on our own. And anytime we can make a baseball practice, we'll make it. I'll be honest. If you have a baseball coach, This is so situational dependent. But if you have a baseball coach who's like, look, if you don't play for my team in the fall, if you don't play for my team or don't come practice for my team in the fall, he's not going to play in the spring. I'd say, okay, we'll have to find another team in the spring. I'm sorry. There's so many so many teams out there now. There's so many travel teams, so many competitive level teams. You're more than likely to find another team that will take on your son and allow him to play, even though he's playing football right now. Okay. In my area alone, I can count 9 different competitive league teams in the 12U bracket, and that does not even count the 2 largest organizations that we have in my area. That's 9 independent teams. If we do math, that's a lot of spots. So I think we're going to find somewhere for your son, James. So if you look at 12U, in 14U, it's the same thing. I just would say the same thing. Like, well, okay, but how about, and just talk with the coaches. I'll be honest, most coaches we deal with here, and more, maybe we have an exceptional sample size of coaches that are okay with this. They want good athletes on their team. They want good athletes, and so they want them to go play other sports. And because when they play those other sports, they develop even more athletically, and they come back and they're better than they have been in the past. And they may be a little bit behind. They're a little rusty on their swings. The pitching is maybe just not where it needs to be in regards to like mechanics, those type of things, all of which can be worked on during the season for football, but it would have to be done on their own time. But when they come back and play baseball in the spring, they're just better athletes, and they just do better generally. And so I'm not saying that those that don't play other sports and only play baseball are going to be, are bad, or they're being overused, or I don't know if that's the case. It really is a case by case basis in regards to the coaching. But I really have found, and I can tell you this, there is substantial research on early sports specialization and the negative effects of it, as well as there's some research suggesting that early sports specialization is helpful. However, what we found in that research is it doesn't take into consideration some other factors. And so what I would suggest is, and it's not specific to baseball, that research, so just so you know that, but my suggestion has always been play as many different sports at competitive levels as you possibly can, as long as you can. We've kind of looked at this dying age or breed of multi-sport athletes in high school, and that still happens, and it's a great thing when it does. But there's also more kids, and maybe the talent pool's bigger and better, and so it's tough not to be, especially in those more skilled sports. But at the same time, the better athlete you are, the better chances I think you're going to have playing any sport. And so I think it's important to continue to play multiple sports for as long as possible. So James, I hope this answers your question. I think one of the things that we kind of glossed over and didn't even mention in this question is, hey, what sport does your son want to play? If he wants to play football, let him go play football. We play sports to develop as humans, to learn life skills, to go play and have fun and to learn how to work as a team. There's so many advantages of playing team sports, and we all know what those are. And so the key here is, you want participation. You want them to play. You want them to be a part of a team, and you want them to do those things that they're interested in. And I get it. Like, you want to make sure that they've got good talent. There are times where they don't want to do anything. You have to play that weird position where you push your child a little bit to continue, even if it's not the most fun at the time, but they learn hard work and grit, which I think is really important. And yeah, but man, if you're like, look, son, we got to go back. We're going to miss football practice because of baseball. We're going to miss football practice and potentially games for baseball practice. I would really hate for my son to turn around and go, well, Dad, I like football a lot more. And I'm like, well, okay, let's go play football. You know what I mean? And I think that's important to note. So, sorry, maybe a little ranty on that one, James, but this is something we deal with quite a bit. And I can tell you this, there are multiple athletes that we're working with here at Athletic Potential where we highly encourage playing multiple sports over, that are in season. And it is my experience that those athletes do really well long term. I really don't even mean sport. Like I really think the athletes that I've worked with in the past that played multiple sports all the way up to, if they could, through high school, they're not all like this, and I hesitate to say this, but it seems like they're just good humans. They know how to interact with people. They interact, they're more resilient, and I know it's overgeneralization. I'm going to hear back, oh yeah, but I get it. But I can tell you this, the athlete that can play multiple sports, move in multiple directions, is going to play, is going to have a better chance of playing in different sports than others. And I just think they've learned more in different situations in the same sport they always do. And in life, I think that's a great thing. So, this is something we talk about at Athletic Potential all the time. Our job, one of our jobs here, is to obviously help our athletes achieve their maximum athletic potential and get them to wherever it is that they want to go. We talk about point A and point B all the time. If point B is collegiate baseball, great, let's help you get to collegiate baseball. Yet we also have an underlying principle at Athletic Potential that we develop good athletes and good humans. I don't think it's actually worded like that, but you get it. Good people, and that are just good in every way. And we try to build that into in the way we train, and how we talk, in our mindset. All of that comes into play with our multiple sport athletes, but any of our athletes, we try to teach that as well. So, James, I really appreciate the question. This is a question I think a lot of people have, and there's a lot of information, and I think depending on who you talk to, you're going to get a lot of different answers. And I look at it from the standpoint is I really, the only vested interest I have is in my business to make sure that all of our athletes achieve their maximum athletic potential. And if I feel like an athlete's going to achieve that by playing multiple sports, that's the recommendation I'm going to give. And in most instances, that is the case. And so, James, I hope that helps. I really hope that helps. All right, 2 questions today. That's the end of our questions. And let's go over recap. So today we talked about a collegiate baseball player who had some selective instability in his shoulder, required some very specific testing to figure it all out. We're able to figure it out, and currently he's doing fairly well on a very specific and individualized plan. Emily asked a question about softball pitchers and the most common injuries: shoulders, then backs. You avoid them by teaching good core strength and good posturing, and making sure the shoulder blade and shoulder move well and have good strength. And then James asked a really good question about early sport specialization and how to manage multiple sport athletes that may be trying to manage both sports at the same time. And that I'm a big fan of in season, play whatever's in season, pick a priority, so to speak, and that's the priority sport for that time period. And then again, if it doesn't work out, then just understand there's other options than either picking one or the other. There's always seems to be multiple options in regards to trying to manage the multiple sport athlete fields, right? So, and games. So, all right, that does it for Athletic Potential Podcast, episode 23. I appreciate everybody taking the time and come and listen to this. If you wouldn't mind sharing the podcast with friends and family or anybody else you feel like would benefit from it. Also, please ask your questions. We really thrive on the questions. This whole podcast is really built just to educate and just to answer some of these common questions that we can normally get, and hopefully provide some insight so you guys can make some good decisions about your athletic development, or even maybe your sons or someone you know that you have interest in that you want to see succeed. So we appreciate it. Appreciate you taking the time, and we'll catch you next time. Thanks.